Assalamu alaikum and very hello to all. Myself BUSHRA Fatima is a dietitian again in this video. This video is very different from my content, but I feel to share it because it's very important. This is very latest and update news relating health conditions. So be safe and make others safe also. As corona is spreading very fast in the world, the changing form of corona has put not only India but the whole world in trouble. This on 22nd December 2022, our PM have called high review meeting on this subject, including health ministry officials. I will show you the few important clips discussed on the latest press conference at WHO on 21st December 2022. Possibly I will be uploading a very next video which relates the precautionary measures to this pandemic and relating diet and lifestyle.
Hello everybody, this is Margareta Harris in WHO Headquarters Geneva, welcoming you to our global press briefing on current health issues and also thanking you for your patience. I apologise for the late start. Today, the 21st December 2022, which is the shortest day of the year here in the Northern Hemisphere, but I doubt that this briefing, planned to be our last press briefing for 2022, will be the shortest that we've seen. I doubt that very much. As usual, we will start with opening remarks from our Director General, Dr. Tedros Adhanom Ghebreyesus.
Good afternoon and good evening. 2022 has been another very challenging year for the health of the world's people. The third year of the COVID-19 pandemic, a global outbreak of Mpox, an Ebola outbreak in Uganda, wars in Ethiopia and Ukraine, cholera outbreaks in multiple countries, drought and flooding in the greater Horn of Africa and the Sahel, flooding in Pakistan, and numerous other health emergencies. Too many uncertainties and gaps for us to say the pandemic is over. Gaps in surveillance, testing, and sequencing mean we do not understand well enough how the virus is changing. Gaps in vaccination mean that millions of people, especially health workers and older people, remain at high risk of severe disease and death. Gaps in treatment mean people are dying needlessly. Gaps in health systems leave them unable to cope with surges in patients with COVID-19, flu, and other diseases. Gaps in our understanding of post-COVID-19 condition mean we do not understand how best to treat people suffering with the long-term consequences of infection. And gaps in our understanding of how this pandemic began compromise our ability to prevent future pandemics. We continue to call on China to share the data and conduct the studies we have requested and which we continue to request. As I have said many times before, all hypotheses about the origins of this pandemic remain on the table.
The country optimizes clinical care for those who need it, staying home if you can be cared for at home, making sure that you seek medical attention if necessary, and that the healthcare systems can have that clinical care pathway outlined very clearly to deal with those who need the care the most, making best use of those beds, making best use of antivirals that need to be accessible at subnational levels. And it's never too late to vaccinate. I think that's one of the key messages we want to see that's out there. With regards to variants, one of the earlier questions was around variants, and we are tracking variants in China as well as elsewhere. By far, the dominant sublineages of Omicron that are circulating are the BA.5 sublineages. This is true in China as well. We see the BQ1, the BF7, which are sublineages of BA.5, but China also has BA.2.75, and they also have detected XBB. So it's really critical that we are continuing to monitor the known variants.